Hata hakuna hata mata ingi. Sasa nikimeza kitu hakuna kitu inaingia.
I didn't know what to do. I didn't know how to start. I cried.
Kila mtu kwa mgonjwa na the moment yenye nimesema na give up. Mimi kila mtu atakuwa amejudge kwa sababu watasema mimi ndio sikuchunga mamangu.
Conditions like cancer, HIV.
The main focus is to make this person have a normal life as much as possible.
Hapana. Kwa jina la Yesu.
Amen.
So they'll ask themselves, what have I done to my maker?
It's only God who knows when you'll go.
According to the World Health Organization, palliative care is an approach that improves the quality of life of patients facing problems associated with life-threatening illnesses, also paying attention to their families and those around them. Palliative care prevents and relieves suffering through early identification, correct assessment, and treatment of pain.
In Kenya, it's a relatively new concept, but globally, it's a concept which has been there for many years. So it's a care which is given to patients and families who are faced with WHO refers to them as life-threatening illnesses or conditions that pose serious health-related suffering. So these are conditions like cancer, HIV, congenital anomalies to children, or even individuals suffering from organ failure. Could be the liver, could be the kidney, and such. So what this care does is looks at the individual from a holistic perspective. So looks at their physical needs. Are they in pain? Are they able to swallow? Do they have weaknesses? Do they have whichever symptom and address those symptoms? Looks at their social issues. How are they coping with the disease? And even how is the family coping with the disease?
We don't want them to just be in bed feeling miserable about themselves. So we manage these symptoms effectively so that you're able to come up. And over and above that, you also need a lot of counseling. As a human being, you get traumatized when you are told something that is terminal, it's not going to heal. So you are thrown into a spin.
The need for palliative care begins early in the course of a life-threatening illness and continues throughout the patient's journey, using a holistic approach that addresses the physical, psychosocial, emotional, spiritual, and at times financial needs of the patient.
Most of them, once they are taken through palliative care in good time, they do very well and they live longer and live a positive life.
Now, as we've understood, palliative care is administered not just to patients, but also to families and caregivers to these patients with threatening illnesses. The aim is to relieve suffering, reduce pain, whether psychologically, physically, or emotionally. Now, we are in Dandora Phase 4, and I'm with Nurse Elsie from Nairobi Hospice, and we are going for a home visit for us to understand palliative care further and just to see what happens in a home visit. We obtained consent from the patient and their families through writing before filming. All were willing to share their life's journey and personal experiences under palliative care.
Vila nilianza kutibiwa. At least kuna nguvu kidogo.
Esophagus cancer came knocking at Joyce Obara's door in the year 2020, even though it took her long to discover.
Nilikuwa nasikianga tu kidogo kidogo, kimeza kitu, nasikia uchungu kwa umbali.
The condition has also affected her hearing ability.
Umekuwa mgonjwa kwa muda gani? Umekuwa mgonjwa kwa muda gani?
On top of this, she cannot swallow anything. Anything that she needs to take, including fluids, medicine and food, having to be inserted through this tube.
Sasa nikimeza kitu hakuna kitu inaingia. Sasa ndio nikaenda hosi, wakaniambia niende nipimwe CT scan hii ya chest. Nikapimwa, wakapata kuna katiuma kadogo hapa kwa koo. Sasa wakasema hiyo haonyeshi vizuri. Sasa tena wakanituma, wakaniambia niende nipimwe endoscopy. Sasa ndio nikapimwa, sasa ndio ilitoa vizuri hiyo katiuma.
It is a dilemma for patients like Joyce when it comes to treatment. Many are caught between a rock and a hard place. Some will choose staying at home, either due to lack of money or having lost hope knowing that they might not get well. Some will choose not to seek treatment at all, complicating their situation further.
With the current financial status, it's not affordable to most of the people, and therefore you realize most of the individuals will not go to health facility unless they really need or unless they have the resources to.
The care of the patient involves a lot of investigations, a lot of aggressive treatment that most of the time is very expensive and usually takes almost all the resources the patient and the family has. By the time the family and the patient and even those who are caring for the patient realizes that there's no more they can do in terms of curative, most of the resources will have been spent.
Sasa ndio nikakaa vile pesa haikukua. Hata matibabu nimeanza tu juzi. Nilikuwa nimekaa tu.
Quinta Abara, her daughter and only caregiver, explains how the situation has been tough. At some point, they had to stop her mom's medication due to lack of money, but through hope, they soldier on.
Vidole zote hazitoshanangi, so kuna time tuna stop because pesa hazijafika na hakuna kitu tunaweza fanya. Like hakuna kitu tunaweza fanya basically because siendi job na bado lazima nikae hapa nikimwangalia, siwezi mwacha peke yake. Siwezi ambia mtu amwangalie pia. Alafu ni kila mtu ni mimi anaangalia. Every call ni mimi, familia ni mimi. Wakiniuliza mama kwaje, how is everything, ni mimi tu bado. So basically hiyo bado ni ngumu. Hiyo bado nimekuwa too much for me kubea, but lazima tu niibee kwa sababu kuna mtu mwingine anaweza.
Now, after diagnosis and during the treatment process, patients with palliative care needs fear. The fear of the disease worsening, fear of death, and those of being a burden to their families and loved ones.
Sasa hii at least naona hata at least naweza ongea, hata sikuwa naweza simama.
Siku hizi like silly cause ati na feel uchungu or something. Acha mwambie mama penye isha imenifikisha. Sina hata feeling ya kulia. Niko tu. Na siwezi blame. Kwa sababu siwezi blame kwa sababu kila mtu kwa mgonjwa, na the moment yenye nimesema na give up, mimi kila mtu atakuwa amejudge kwa sababu watasema mimi ndio sikuchunga mamangu.
No one can tell the thin line between death and their life. However, patients living with palliative care needs sometimes ask how much they have left to live, depending on the diagnosis and response to treatment.
A good number of our patients believe in a superior being or a higher being. So they'll ask themselves, what have I done to my maker to deserve this illness, and such questions.
It's only God who knows when you'll go. Yeah. So we want you to be positive about things and think positively about life.
Elsie Gaitugi is a nurse from Nairobi Hospice. She has dedicated most of her time to take care of patients. Her aim is to holistically improve the quality of life of patients like Joyce. The key thing is putting life into their days and not days into their lives.
And as you see it as hospice, we'll manage the symptoms for mom, make sure she's not in pain. Then as she goes through the treatment, then we leave one day at a time.
Patients with life-threatening illnesses go through a lot of pain and distress. All in all, they have to battle to survive one day at a time.
Na sisi tunakuombea upone kabisa, upate nguvu, si ndio?
Unaombewa upone.
Ha?
Unaombewa upone.
Andapona. Kwa jina la Yesu.
Amen.
Amen.
This type of pain cannot be controlled with standard medical care, and therefore, with palliative care through the help of hospices, they reduce the patient's discomfort by providing pain management medication to work hand in hand with the treatment of hospitals.
Because unajua si hizi painkillers za huku zinaweza msaidia hivyo sana, because uchungu ni ile kabisa. So at least hizo pesa za painkillers tumekuwa able to save. Na plus kuna vitu zenyewe si lazima tununue, because hospitals wamekuwa wakiprovide.
We walk that journey together with the doctor and the patient. And usually when that is done, the patient's treatment process is easier. They live a better life because at the end of the day, they have quality life.
What you have seen is that there are some patients who receive curative treatment and move out of palliative care services. But a significant percentage of those individuals will receive the curative care, but sometimes that might not work, or the individuals might not get 100% cure, and they transit with palliative care and support care up to end of life. And once the individual passes, we still continue supporting the family, what we call bereavement support. So it doesn't have a specific point in terms of diagnosis, but we say once the individual is diagnosed, they should continue with it throughout.
Worldwide, an estimated 56.8 million people are in need of palliative care yearly. Only about 14% of people who need palliative care currently receive it. In Kenya, about 1 million people require palliative care, with only less than 5% of adults and less than 1% of children having access to such care.
So it tells you that there is a big gap in terms of access.
Majority of the poor people in our country have actually found solace and a benefit and relief when NHIF presents this solution. When NHIF will capture most of those who are the poor of the poor. And it has been a big problem when palliative care, which is very important and so key in the care of these patients in their last days, has not been captured.
It has been a constant struggle for Carol Otieno, in and out of the hospital, having diagnosed with breast cancer in the year 2017.
Lianza 2017. 2017 nilianza tu kusikia kamvimbe tu hapa kwa matiti, but sikujua nikaanza. Nilikuwa nadhani tu ni kitu ingine tu, ugonjwa tu.
Things have not been easy for her. Today, Nurse Elsie has brought her some more medication, including painkillers. She also helps her understand how and when to take the medication.
Hii ndio inakusaidia kuacha kusikia kiungulia na at least kusettle tumbo. Na ndio maana pia ulipewa hiyo. Sawa sawa. So unatumia hii kiisha na ile yenye iko pale ndio unaendelea na gani na hii. So usitumie zote zikiwa pamoja. Sawa sawa. Hapo tuko pamoja? Usingizi kwa aje sasa?
Sahi at least naweza jaribu.
Unalala masaa ngapi kwa usiku?
Mimi hadi tena ni kidogo tu.
Kidogo.
Mimi silalangi. Mimi nakaanga tu macho.
Nakaa macho sana. Na mchana unalala?
Mimi silalangi, nakaa tu hapa kwa kiti.
Palliative care is the last line of hope for patients who have lost hope in the cure of their illness.
Kansa sio mchezo. Lazima nifuate tu venye daktari anasema. Siwezi cheza na matibabu. Siwezi cheza na matibabu. Nimechange kidogo. Nitapona.
After a spirited fight that lasted for almost 5 years, unfortunately, Carol Otieno rested on the 11th of September. All said and done, she is a warrior whose story shall inspire generations to come. May Carol rest in peace. Suffering from a life-threatening illness can affect one mentally. It is said that a problem shared is a problem half solved. To ease the burden of stress, those who are able meet in groups to share and motivate each other. Patients with palliative care needs live one day at a time. I am privileged to attend one of their sessions organized by the Kenya Hospices and Palliative Care Association. The patients share their journey, the challenges. Some can even afford to smile after listening to a problem that is bigger than theirs, at the same time receiving counseling from experts.
And told me, your kidneys are failing. I didn't know what to do. I didn't know how to start. I cried. I went home. I almost fell into depression. So I just picked myself up, and the journey still continued. Life was so hard, but I had to be there for my daughter. It reached a point I even kept my daughter at home. I could not raise the school fees. I could not even afford the food, even the strong tea, the simple one. I was taking medication. I was under medication. Here, I could not make it all alone. It was so tough.
Kusikia niko na kansa nililia, lakini hata nilipolia nilikuwa na mambo mawili niliuliza Mungu. Hii ni ripoti ya daktari, na mkono huu mwingine nikamwambia hii ni ripoti yako. Ripoti yako inasema nini kunihusu? Wakati nilifikiria imenihusu nini, kwa sababu wakati niliambiwa niko na kansa nilishindwa nilitoka wapi, nikashindwa hata kujua jina yangu. Ilikuwa 2019 January.
It is easy for the society to stigmatize and discriminate such people. The fact that they suffer from life-threatening conditions, some are misadvised and believed to be cursed. Due to this, some seek alternative treatment like herbalists.
Sasa hao wanajitenga na mimi. Yule ameroga. Sasa ili nisimame niambie mimi niko na kansa. Sasa kama yeye yule ambaye yuko close na mimi anasema nimeroga, sitaweza kusimama ile mtu asimame.
Isipokuwa watu wa nyumbani wakisikia kama mtu ameungua saratani wanaanza kumkataa. Na nawasihi mtu akiwa ameugua ugonjwa wa saratani, na si watu wa nyumbani wa familia wampende. Pasipokuwa na upendo, huyu mtu hawezi akakaa, lakini akipendwa ataishi sana.
There stands a gap to improve the quality of life of persons living with palliative care needs. Hospices provide great support to such patients. However, some areas in Kenya have no hospices, and where there are hospices, services like NHIF do not fully cover such conditions and hospice care.
It has been a big problem when palliative care, which is very important and so key in the care of these patients in their last days, has not been captured.
So when the president introduced the universal health coverage, I think it's a good move, and unfortunately it hasn't captured all the aspects of we would require for palliative care, and therefore we are actually advocating for the policymakers to factor in palliative care in that universal health coverage, so that we ensure the million Kenyans in need of these services have the access and are able to get the quality of care without experiencing the financial burden.
Not everyone knows the existence or where to access hospices or palliative care services. After being discharged, they have nothing to do but just hold on to that thin rope.
Palliative care works, and we are kind of advocating for that loudly, so that the physicians and any other person who manages a patient can refer these patients in good time to get the good support service they require. NHIF, we are beginning to engage with them because I think there's a portion of treatment that was left out, because they can cover for you chemotherapy, radiotherapy, but the after is not taken care of. So we are trying to tell them treatment should be 360 degrees. Once I go for treatment, there's the outpatient thing that I need to go for care, the symptom care. So if they could devise some packages that can address that, it would really assist the patients.
Palliative care plays a very huge role, not just in the lives of patients, but in the lives of their families and those around them. It is clear that if palliative care was not in existence, then the gap in the healthcare sector will be very huge, and it will be hard for patients who require a holistic approach in spiritual, psychological, emotional, and physical health to hang on that thin rope. It is therefore very important for government and policymakers across the globe to fully integrate palliative care in the health system.